Good morning, everyone. I hope you're having a wonderful day. I'm Dr. Gursiv Sandlers. This is my YouTube channel. There are a lot of videos that I have posted in the past, but now I'm going to start off with a small lecture series. Not really lectures. Lectures are very boring, but I'm going to talk about maybe small 5 minutes talk about common conditions which affect children, and what are the points that you should look for as a parent at home. What are those pointers which tell you, yeah, maybe there's something wrong with my child, and this is the time when I should go to and visit a surgeon for that matter. Now, coming to that, please remember, just because I'm a surgeon doesn't mean I only operate on children. There are a lot of other conditions that we as a surgeon deal with. I think the first one that I'm going to begin with today is a big topic, very close to my heart, and we are seeing a lot of children today suffering from it, to the extent that I would say that maybe about 1 in 3 children today below the age of 10 years is constipated. So constipation is a big issue in today's generation. See, 10 years, 15 years back when we were doing our training, constipation was not that common in children, and whatever we would see in our outpatient departments would usually be constipation having some kind of an organic cause, maybe Hirschsprung's disease or some other problems. But of late, in the last 6-7 years, there has been a very rapid spike in children who are having constipation, who are having hard stools, to the extent that we have to admit them, give enemas, and evacuate them. Now, how do you avoid your child reaching that stage? So the first and foremost thing I think you need to remember is, just because a child is passing stool every day does not mean he is not constipated. In fact, a majority of children who come to me are passing stools almost every day. That's what their parents will tell me, like, no, he does pass stool every day. How can he be constipated? See, the problem in these children is not the frequency. The traditional definition of constipation has always been that you don't pass stools for 3 or 4 days, and that's what you call constipation. Unfortunately, I think that definition needs to be redefined, because these kids are passing stools on a daily basis. So how can we label them as constipation? Because I believe the problem in these kids is not the frequency. The problem is of evacuation. So the number one thing that you need to remember is your child passing stool early morning, which is what they will not be doing. Today's kids, majority of what we see in our OPD, or the ones who are constipated, usually don't have a potty schedule. They would go at any time of the day. It could be in the morning, it could be in the afternoon, it could be in the evening, or even late night prior to sleeping. So if your child doesn't have a potty schedule, the chances of him getting constipated are higher. Now, I'm not saying all kids who have an altered potty schedule are constipated, but it's one of the primary markers that we look for. See, an early morning complete evacuation is the best way to avoid constipation. So that's what you should be aiming at early on. Start toilet training at about 3.5 years of age. It cannot be earlier than that. Toilet training again is a separate topic which I'll talk about later. Maybe in the next lecture, since we are talking about constipation, I'll talk about how you go about doing a toilet training in a child. But as of now, the first thing that you look for in your child's habit is he having an early morning evacuation? If he's not having an early morning evacuation, if there's no time limit, the chances of him being constipated are higher. Second thing that you look for is, what kind of a stool is he passing? Is he passing a hard stool? Is he passing a pasty, sticky stool? Is he passing a stool which is hard to flush down the toilet? That's the second pointer. Third pointer that you look for is, how are his eating habits? Is he a happy eater? Is he a fussy eater? Is he a child you have to literally force feed and he doesn't eat very well? And there is always a bloating in the stomach. He always keeps complaining. He'll eat half a chapati and he'll be saying, I'm full, I don't want to eat anymore. That's the fourth thing. The fifth pointer that you should be looking for is, do you find potty stains in his undergarments or on his clothes, especially when he comes back from school? That's something that tells you that maybe he had an urge in school. He did not go there, tried to suppress that urge, and a little bit of it leaked out. Now that again is an extremely strong pointer that the child is constipated. See, all of us have this habit of developing an urge once a day. It doesn't matter of the timing. Like I said, most of the adults will get an urge early morning. That would be the best reflex that you will have. And if you don't go at that time, the secondary reflexes which will come are usually not that strong in nature, and the child tends to suppress it. Please remember, today's generation is extremely distracted. TV, there are too many screens at which they look at, and they tend to avoid and ignore other signals that their body is trying to give. So most of the times what I've seen is the child will get up too late. If he's got a 7 o'clock school bus timing, he'll probably get up at 6:30, 6:45. Will be in school bus by 7, even before his body has a time to wake up. So his brain is awake, probably slightly hazy. The brain wakes up slowly. The body tends to wake up about half an hour, 45 minutes, 1 hour after that. So most of these kids would tend to get an urge to defecate or pass motion somewhere around midday of school. Now, most of them would not go to the school toilet because they find it too dirty or too filthy or too crowded. So they will suppress the urge. Once that urge is gone, they probably won't get another urge till late evening, which is their playtime. They tend to sort of suppress that urge also, because playing is a very significantly important activity for a child. So when will he poop? He'll probably poop somewhere in late evening, somewhere in the evening, and that also when he can no longer suppress that urge. But what comes out is generally a fraction of the total stool quantity, and that tends to sort of build up, back up, and the whole backlog eventually ends up clogging his own system. And one fine day, suddenly you will find he'll be crying out in pain. He will have a bloated tummy. He may vomit or he may not vomit, but he'll definitely have a significantly reduced appetite. So these are the 3-4 pointers which I believe as a parent you should look out for. And if you find any of these things happening, it's better to visit a surgeon. See, it's not that I'm going to operate on the child, but constipation as a topic is something that is dealt better by surgeons. We deal with it better. I'm not saying it's a hard and fast rule. You can always visit your pediatrician. So the crux being, if your child at any point of time has any of these symptoms, has an irregular potty schedule, you find swelling in his clothes, you find that his appetite has gone down, he constantly keeps complaining of bloating or an occasional ache in the tummy, or is full with only half the quantity of what he would normally be eating, these are all pointers towards constipation. Even severe symptoms can be a general lethargy, a general lack of activeness. The child doesn't want to play, doesn't want to run around, want to sit down all the time. All these are indirect markers that the child may be constipated significantly. So if any point of time you find that any of these symptoms are seen in your child, please visit a doctor, either a pediatrician or a pediatric surgeon, and get this resolved as soon as possible. Constipation in children today is actually a lifestyle disease. Too much of sedentary lifestyle, very little activity, a significant proportion of their food is junk food. I'll talk about the diet in probably some other lecture, but these are the things which contribute to constipation in the longer run. And I firmly believe that constipation is the lifestyle disease of the children in the 21st century. Thank you so much for listening. I'll come back and maybe in a couple of days we'll talk about what and how do we go about making a potty schedule for a child. Thank you so much.